particularly amazed at your passion for insulin in relation to type 1 versus type 2 diabetes, because as you said, and I was listening to your low carb Denver lecture a couple of days ago, wherein you were stating that in type 2 diabetes, since the problem is insulin resistance, then technically the more you give insulin to the patient, the more potentially insulin resistant that patient becomes, since you are not really treating the root cause. And I think I also heard this from Ben Bickman. He was comparing insulin to, it's like he was comparing giving insulin, administering insulin to a type 2 diabetic to an alcoholic, wherein if you want to treat an alcoholic and you give him more alcohol, ethanol, it's not really solving the problem, it's making the problem worse. Do you agree with that?
Oh yeah, I love that analogy. I think he's right on. He's a brilliant guy, and I think what we see is that we're making ourselves feel good by lowering the sugar, but you're just trying to force the body to take more and more of this substance that it's rejecting, right? The message is very clear. The sugar stays in the blood because the cells are not interested in having more energy. They're stuffed with energy. And since insulin doesn't just bring in sugar, but it also stores fat, this is the one other function of insulin, then the fat cells are overstuffed and they don't want to respond to insulin anymore. They have stored enough energy. So basically, the body is saying, we have enough for this particular body.